My name is Dr. Stephen Mock. I am a urologist at the Everett Clinic. So I did residency in New York City at Mount Sinai, and we saw lots of different pathologies, kind of going back to the original reason why I chose urology. And the things I was most interested in was one particular person I worked with who also specialized in urinary incontinence, where the satisfaction his patients were after seeing him was just immeasurable. You take a person, man or female, who's, let's say, incontinent and having a terrible quality of life, and if you can help them not be that way anymore, there was really no greater feeling. And that wasn't even my patient, that was his patient, but he was able to convey that to me to the point where I decided to spend an additional 2 years in fellowship just so I could kind of derive that sort of satisfaction from patients. Urology spans the gamut from benign conditions such as kidney stones, peeing problems in guys, enlarged prostates in women, urinary incontinence, to various malignancies like prostate cancer, kidney cancer, bladder cancer, and we deal with all of that stuff. My role with my patients is pretty much, I think, a conduit of information and services that we can provide them to address the problems that they're coming to see me about. Personally, I'm most interested in urinary incontinence and pelvic organ prolapse, a lot of benign quality of life issues, nothing that's really a detriment to their longevity of life, but they're absolutely a detriment to their quality of life. And that's mainly the reason I chose the field I chose. We would speak, we would talk, we would see how burdensome the symptoms are, and if I could provide any sort of information, whether it be just lifestyle changes, behavior modification, and if need be, medication or even surgery to kind of maximize the quality that they of their life. That's my ultimate goal and ultimate job. My focus on patient care is really driven by patient choice. A lot of things I specialize in, it's quality of life issues. So when it comes to quality of life issues, the patient is ultimately the person that makes the primary decision. It's something they embark on. I'm there to counsel them and weigh kind of the risks and benefits, but it kind of empowers patients, my information to them and the options that they have that I can present to them, kind of empowers them to make the most informed decision possible.